welcome back to Cure Connections. In this segment, we are joined by Diane Rose, and she is the Vice President of the Volunteer Programs at the advocacy group Force. In this segment, we are going to discuss mutation testing and the risk for patients who have the BRCA, the BRCA mutation. Diane, welcome to Cure Connections. Welcome back, Michelle, Greg, and Dr. Secord in this discussion about ovarian cancer and mutation testing. Diane, you have personal experience of the BRCA mutation, as well as being able to help other patients understand about mutation testing in relation to this disease. Tell us about your personal experience and involvement in ovarian cancer and mutation testing.
Sure. So my aunt, my paternal aunt, shared with me and my family that she carried the BRCA1 genetic mutation after she was diagnosed with ovarian cancer. And she shared with us that there was a genetic test that we could take to determine our own personal risk, and that family members had a 50% chance of carrying this same mutation. So my father chose to be tested, and he tested positive. And so then, myself and my siblings realized that we also had this 50% chance now of carrying the genetic mutation. So I was 38 years old at the time, and I just felt very strongly that I needed to know if I carried this mutation so that I could be proactive with my health. I have 3 children, so I wanted to make sure that I was doing what I could so that they could also, know their future health history as well. So I met with a genetic counselor and determined that I would go through with the genetic testing, and then I did test positive for the BRCA1 mutation.
A couple of questions I have for you. We're hearing about obviously ovarian cancer as a cancer of women, and yet it was your father's sister that carried the genetic abnormality.
Exactly.
How did she find out about that? Was that from blood work, or was that as a result of the surgery that she'd undergone herself?
Once she went through her surgery for ovarian cancer, her gynecologic oncologist recommended that she have the genetic test. She was 53 at her diagnosis, and being so young, he said, that was a very strong warning sign that she might be a mutation carrier. So that is why she decided to have the genetic test done. And as we know, the mutation can come through men or women, a 50% chance for that. So that was why my father chose to get tested.
And we're going to be talking later in the segment with Dr. Secord about the fact that this mutation, this abnormality, is not just associated with ovarian cancer. Was your father tested to see if it had come down the line to you, or was he tested because of increased risk of cancers for him?
Both reasons. Certainly men who carry the BRCA1 genetic mutation have risks for certain cancers, prostate, melanoma. And so, he wanted to be able to be proactive with his own health, but also there's 4 of us children, and he wanted to make sure that we could make decisions for our own health as well.
And when you sat down and had the conversation with your aunt, you said that after you got this information, you went forward to meeting with a genetic counsellor. How easy is it to find a genetic counsellor? How did you go about getting to the right person to get those tests done in the first place?
So for me, it was relatively easy because I live outside of Philadelphia. We have many options for genetic counseling in the city, and I just went to the same genetic counselor that my aunt had gone to. She was already familiar with our family history, and so it was just a natural step to go to the same doctor. She had everything already mapped out.
And when you met with the genetic counselor, what did that involve? Did it mean going straight to having blood work done, or did they have a conversation with you before about what genetic testing means? And describe that first meeting.
So in that first meeting, actually, my 3 siblings and myself all went together for our genetic counseling.
Did you get a discount if you got
No, we did not, although our insurance covered it, so it was fine. we went together, and it was about a 2-hour conversation.
Wow.
She really sat down. She went through, all of the information. What would happen if we tested positive? What would happen if we tested negative? And because we already knew where the mutation was in our family, they really just had to do a site-specific test. So we would either be positive for the BRCA1 mutation or we would be negative. So she went through all of that with us, and then yes, it was a blood test that we all went to take.
And listening to your story, it sounds like you were quite committed from the beginning, from hearing your aunt's story, that you wanted to know whether you had this genetic abnormality or not. When you met with the genetic counsellor, was there anything that the counsellor said to you that made you think, maybe I'm not so sure that I want to know this information? Or did it just strengthen the decision to proceed and have that information?
It really strengthened my decision to have the information. The decisions after that I knew would be difficult if I did come back positive for the mutation, whether I would go through just increased screenings or whether I would do prophylactic surgeries. But I really did need to know. I just had that strong desire to know if I carried this mutation so that I could then make the next decisions if I needed to.